More than anything else, it's fair to say that a lot of what drives chronic disease in the United States in poor communities of color, which are characterized by health disparities, is the incredible number of folk who've spent time engaged in the criminal justice system.
And so there's another kind of idea about that there are social determinants of health, things that determine health that are not, that are typically outside of the health world. So for example, if there's a decision to build a highway system in the 40s and 50s, what's happened now is that a lot of people drive, they don't walk. And so these decisions that are outside of the health realm really determine health behaviors and ultimately health outcomes.
In 1986, I started doing research on HIV/AIDS, and I recall very clearly that in 1990, in a meeting of the President's Commission on AIDS, someone made the offhand comment that because there were so many drug users in prison, the rates of HIV in these facilities had gone up. The fact that nobody picked up on that really shocked me. So the more I looked at the changing face of the epidemic, the more it went from being largely about gay white men to being all about men and women of color, the more I started to ask the question, to what degree am I looking at a phenomenon that's in some way connected to, if not driven, by what has to be the war on drugs and our commitment as a nation to mass incarceration?
There was an epidemiological study that showed that for each year in prison, people lose 2 years of lifespan.
When folk who are from communities that suffer under the burden of illness go into an institution that, if anything, is going to make their conditions worse, come back into a community that is unable to care for them, that is unable to provide them with access to the kinds of health care and preventive care that's necessary.
Being involved in the criminal justice system typically involves ability to have employment. We know that's related to all sorts of health outcomes. Children's trajectories into the future. If you have a parent who's incarcerated, you're more likely to become involved with the criminal justice system. You're more likely to have behavior problems, not get as good of an education.
A lot of what we are spending as a nation on public health is being driven, in some respects, to a great degree, by the problems that have been created in our prisons and that are exacerbated by them. So seeing the two is connected partially involves helping people understand how much we're spending on them, how much spending on them is actually spending money in a way that is foolish, unproductive, and ultimately unhealthy, and getting folk to sort of rethink.
If we want to improve the health of a population, what's really going to work is if we get to the health of those who are most poorly impacted.
What good are we doing by locking so many people up? And to what degree would we be, as a nation, much healthier if we had other alternatives to thinking about people as jail fodder?